Good evening, doctor. Myself, Dr. Santosh, inviting you to attend Dr. KK Agarwal Med Talks. Today is the 518th session on role of probiotics in COVID-19. Today we have an expert, Dr. Joy Verghese. Doctor is the director in the Department of Hepatology and Transplant from the Gleneagles Global Health City, Chennai, with us. Welcome you, sir.
Thank
So,
you.
yes, as you there is a COVID third wave came into a picture, and there is a lot of query from the physician side and the patient side. So, to discuss it, like how this thing happens, how these probiotics come into picture, and what is the benefit of it. So, initial, sir, what is like just brief about how Omicron it is different, and what is the sign and symptom, and what patient or the doctor has to take care it further on behalf on mainly focus on the gut and the liver. So over to you.
Thank you, Dr. Santosh. Good evening to all. Uh, I'm a hepatologist and a transplant hepatologist. So I am seeing Omicron or the earlier COVID in a two different entity because 2 years ago, when we faced that COVID, the first phase, we stopped all the elective procedures. And there were a lot of restrictions was there. And we have seen so many of my known circle and those who have suffered and they need ICU admission. There was a lot of things and the challenges was there. But over the period of last 2 years, so we learned a lot and how to manage. And at the same time, now due to the mutation, we are seeing the Omicron is not that effective like what we have seen in earlier because in the earlier time I have so many referrals used to come to me with the altered liver function also those patients admitted in the ICUs in the COVID ICUs. So we know that the AC2 the receptor not only in the respiratory epithelium it is will be in the colonic mucosa and it will be in the liver cell also. So some of the patients will have the diarrhea, some of the patient with altered liver function, and most of them will have the CIRS, the cytokine storm related the lung issues. Some of the patient I have seen due to the COVID related liver cell failure and the patient got the secondary other opportunistic infection and the recovery there was impossible that time. But now, this due to the Omicron, I have not seen even a single case with the altered liver function test. That is the one of the, good observation we have seen. I have not seen a single case of the liver failure due to the Omicron. And also, we are seeing in practice nowadays the COVID infection, even though comes the Omicron related, the positive, most of them are the asymptomatic. Few of them have the mild infections. So these are the good observation now we are seeing.
Yes, sir. Yeah, that is true, sir. But in the COVID first and second wave, there is a lot of doctors that say about liver function, even because all the drugs, even the remdesivir and all, they say that. So that means there is some liver is one of the important organ for the management of the COVID-19. So it is like it. I feel that there is a connectivity because I'm not able to understand, sir. There is a gut and there is a lung and there is a liver. So how it is connected each other?
Yeah, it's really a good question. The lung, liver, and the gut. If you see, if you now we'll talk about the COVID-19 alone. So that's already mentioned. The COVID virus, the RNA virus, enters our cells. Suppose if there is a respiratory system means respiratory epithelial cells through the ACE2 receptors. And within the respiratory epithelial cells, once it invades, it multiplicates and it will affect and it release from the infected respiratory epithelial cells more and more. Same way, in the gut also, this COVID-19 SARS-CoV-2 virus enters through the ACE2 receptors and the colonic epithelial cells. Within the cells, it's getting multiplication and it'll get released. So that's why we can notice already documented the feces also, the virions. Similarly, in the liver also, it goes and attaches with the ACE2 receptor of the cholangiocytes and it causes the altered function. Apart from that, the COVID virus direct invasion, there are other way the disease scenario will vary. That is, one is called the leaky gut. Whenever there is an inflammation is there, the GAT particularly, that will alter the gut microbiota. So we know in the gut more than 10 to the power of 14 microorganism has been there that will do lot of work, not only for the digestion process, for bile acid metabolism, bile salt metabolism, vitamin formations, and controlling the other infections, and in simple way body immune related, all the overall systemic inflammation also it will control if there is a good microbiota, if it is there within our gut. If this gets regulated, that's called dysbiosis. Normal microbiota is getting changed. So how it can change? If you are taking more and more antibiotics, that time the gut flora will get changed. That's why we are seeing antibiotic induced the loose motion diarrhea. So there is one example. So whenever if you are infected patient, if the gut microbiota gets changed, once due to the leaky gut, once the inflammation invades into the bloodstream, it is causing the systemic inflammatory response that will affect distant organ also. So one of the distant organ we can say here lung. That is called gut lung axis. Another one axis there, gut liver axis. Whenever there is a inflammation in the gut, if there is a leaky gut, it can cause the inflammation in the liver also. It has been well proven in all form of the liver related disease, either the fatty liver related disease or viral, whatever if we say autoimmune, final pathway will be the gut liver axis. Similarly, here in the either COVID or in other respiratory infection, there will be called gut lung axis. This will aggravate if your patient sits in this kind of the lung and the gut, this axis get activated, the inflammation process will, if it goes very well, that will cause the more and more damage in the lungs. So that's why the probiotic related, the thought process, it is not a new concept. It has been already used in the various lung diseases. If you go through the literatures, even if the simplest way we can say asthma, allergic reactions. So allergic reactions, people, there is the axis called the gut lung axis. So if it gets controlled, there have been, is proven it is reducing the asthmatic incidence. So this kind of the probiotic will help to the patients to prevent the leaky gut related inflammation. So it is reducing the gut lung axis related to the activation of the inflammatory pathway. That's why the end organ will get we can protect.
Yes, sir. Sir, this is a nice concept to discuss that lung and gut axis along with the liver axis in between. Sir, in the discussion when we went to the website and all, there's a lot of COVID and CVD, cardiovascular and diabetes and all. But we want to understand what is the long-term complication. I know it is very difficult to assess right now, for especially for the liver because it is something like nobody discussed till now. Liver talks. You just discussed. So what is the long problem which you are facing, especially on a liver failure or something which you come across?
Yeah. See, if a COVID-19, the virus related and the liver, if you look into that, one I said the direct invasion of the viral particle into the hepatocytes and the cholangiocytes through the receptor, and it causes the inflammation. There will be the mild signs and symptoms, I can say. There is a elevation in the AGPT level, AGOT level, sometimes the GGT level we are seeing. But other things are different. Suppose COVID patient got the cytokine storm related inflammation that will affect the all the organs. That time the part of the CIRS related effect will be in the liver. That will behave in a different way. It is a slightly higher way. The patients have the long-standing transaminitis. The transaminitis related, there is a liver cell failure. That's why I said few of our patients we have seen they recovered from the severe COVID. They got admission in ICU. So I'm talking about in the last 2 years experience wise. Those who have was very sick on ICU due to the COVID related the lung issues and they recovered very well. But after recovery, once the patients are coming for regular follow, they are consulting the pulmonologist. They noticed incidentally there is the rise in the liver enzymes. Then they referred to here. When we follow it up, we did all the etiological workup for the liver dysfunction. Finally, it ended with everything is related to the severe COVID related the sequelae. We did a liver biopsy. Liver biopsy shows the character. This all recent days published very well. The COVID related systemic illness, if affects the other organ, particularly the liver, what will be the liver biopsy findings? So the liver biopsy like looks like here, the sinusoidal obstruction syndrome like thing. The liver biopsy wise, we identified this all these sequelae of the severe form of the COVID related. It is not the immediate effect to the patient during the follow-up. Third type due to the drug. So the remdesivir, some of the drugs. Okay, suppose you are going to use nowadays they are not using now, but earlier they are going to use the more and more the slightly hepatotoxic drug. That drug related the liver injury and most of the time will be the combination. Sometime already the particular patient might have the other liver problem, for example alcohol consumption related mild liver problem, or they might have the fatty liver problem, or they might have the autoimmune disease. So if they have already a borderline liver, so over that, if there is a inflammation, the COVID related complication or COVID the therapy related thing, so there is a multiple. So we have seen the different types of the COVID related liver injury. Some of the patient gone to the cholestatic. Initially, they have cholestatic jaundice, and over the period of time, they went to the complete the total liver failure, and the patient might require liver transplant also. So these are rare but it is not I can't say the uncommon. So even if we are seeing mean I'm sure rest of the world everyone they will look into that.
Yes, sir. This is a very nice and new pointers because we always say that if hypertension or diabetes go and there is a high risk, but you rightly said that the liver health is also important. And anything about the liver related, please discuss with your doctor and take the suggestion or not. That, but another one like, of course, you come to the diabetes. There are so many diabetic. It's India is a diabetic capital, and you know diabetes lead to fatty liver and all. So if that patient have a COVID with the diabetes, with this thing, anything you want to discuss and suggest to our audience and the doctors?
Yeah. See, the diabetic patients, most of them will have the fatty liver. Nowadays, the earlier we used to say non-alcoholic fatty liver disease, NAFLD. That is the terminology what still we are using, but what was used earlier. Nowadays, we are changing the terminology the MAFLD, metabolic associated fatty liver disease. So diabetic, because why the terminology has been now is changing to that, we know that diabetes is the comes to the metabolic syndrome. So most of the diabetes patient will have the insulin resistance, obesity, triglyceridemia, and most of the diabetic patients has a more prone to get cardiac disease. So everything component comes into the metabolic syndrome. Same pictures nowadays in the fatty liver disease. That's why MAFLD, metabolic associated fatty liver disease. If they get a COVID infection, we know the severe form of COVID, they are used to that time the cytokine storm steroid. So already if the patient individual have the diabetic, if you are going to use the steroid, either the methylprednisolone format or the prednisolone tablet form, definitely the sugar level will get shooted up. So that way that it will worsen the associated the background disease also. So need the proper control. They are more prone to get a secondary infection, any form of infection, the gut infection or fungal infection or so. That is diabetic people getting this kind of the liver disease and having the super added the COVID infection. And at that time, if you are going to the severe cases, if you are going to the aggressive management, that time it should need the multidisciplinary control over the all the specialty doctors, team of the doctor has to manage. That time we won't miss even a single that point of the complication, and we can prevent and we can easily manage.
Yes, sir, that is the nice suggestion for the audience. So another one, you saw leaky gut, and nowadays you just discuss about the antibiotic usage and what is the problem faced with. If that is a use of probiotics, in especially for a COVID-19, how it is benefited this lung, liver, and gut axis, and what is the like benefit from the COVID, especially from the reducing the complication in the future.
Yeah. See, first I will come to the probiotics. So, what are the probiotics we have nowadays? So, there is not a single, okay, it is a combination of the probiotic we are using in our practice. So, lactobacillus combination with the bifidobacterium, and there is the bacillus. So many the combination of the probiotics we are using. We all know the probiotics are very important because they play normally our gut has the probiotics, okay, but the normal flora is maintained by the probiotics, the organism. In case if there is any dysbiosis happens, that time only the altered bowel habits and everything is going into that this kind of the leaky gut. That I can liver side, it has been well documented. There is no doubt about the gut liver axis play a major role for the liver disease progression. If you name it any chronic liver disease, that's why I mentioned either ethanol related. We are thinking, okay, alcohol consumption is directly affecting the liver, that's why the patient getting the liver problem. Of course, that's the true. Alcohol will cause the acetaldehyde and acetic acid. There are so many enzymes are involving. If this the mitochondria, particularly the hepatocyte mitochondria, plays a major role, there is a dysregulation, they'll get the fatty liver. But it will all cause the acute, the immediate injury and immediate effect, which is taking for the chronicity, chronic inflammation. So that the alcohol will cause the gut microbiota also it is getting changed. That will taking over for the chronic inflammation, ongoing inflammation within the liver by the gut liver axis. So if you look into that liver disease, there will be the gut motility will be low, and there will be the secondary bacterial overgrowth will be there. So why there is a bacterial overgrowth? It's not a normal microflora. So unwanted. Okay, why it is happening? Everything's to the proper, the etiology related, the slowness, everything due to the particular etiology related. Once the bacterial overgrowth, that is further worsening and it is causing that inflammation, systemic inflammation, and through the leaky gut. So usage of probiotic in liver disease, the studies have many number of studies are there. How the probiotic is changing the gut flora. Because of the gut flora change, how the ongoing chronic inflammation within the hepatocytes we are controlling. Same mechanism has been documented in the lung infection. Not, and first of all, I'll come to that respiratory lung infection. So many, not the only COVID. COVID we know now, but non-COVID related, so many the viral infection, That time they identified this probiotic usage in the lung infection also. So now we are going to use the same knowledge, whatever we learned by research way earlier, whether the same principle, changing the gut microbiota, changing to the normal flora by giving the probiotics, whether is it will reducing the ongoing inflammation in the lung due to the COVID or not. If you look there, there are few papers has come out, but it need multi-center, large volume, this trial and study. But there are the clinical trial already has been started. The usage of the probiotic in the COVID patients. So that will give the clear idea. But whatever the available, the literatures wise, the case report or case series or the experts' opinion, that everything shows that probiotics is helping to reduce the inflammation in the severe diseases.
Yes, sir. Sir, one nice interesting point. It is not a COVID. Probiotics will help you in any of the inflammation, infection of the body to make it better. So that is the one of the suggestions, right? Sir, and coming to this, there is so much of fortification, like fortified milk or curd. There's one of the question came up, like, can I get the same amount of probiotics in a milk? If no, what I can do? If yes, is it possible to get the exact amount of probiotics is required for the body?
The not milk, I can prefer that I change the curd, okay, yogurt. So yogurt have the rich in probiotics, okay. So if the yogurt, if you are taking properly, so I mean there is no the control head-to-head control study of the yogurt versus the different formulation whatever available in the market, but the yogurt wise that curd related the studies are there. It showed it is helping to the individual for the reducing the ongoing chronic inflammation.
There is one interesting questions also coming from our comment side. Say that in probiotics, of course, you discuss about the gut, so liver enzymes. It will help us. Can it help to beta cell? Because in the diabetes, somehow it is going to help the beta cell to reduce the diabetes or insulin resistance in our patient. Any connection in this?
So, if a diabetes, if you look into that, it is not the entire pancreas, it is only in the beta cells. But a chronic inflammation, if whatever we are talking the liver, it is a chronic inflammation that's going for affecting the entire the hepatocytes. If you look into that, pathophysiology of the chronic pancreatitis, of course, there is a possibility. There are so many chronic pancreatitis. So chronic pancreatitis means not only the beta cells, it affects all the pancreatic cells. For example, autoimmune pancreatitis. Sometimes an idiopathic chronic. So I'm not talking about the acute pancreatitis, chronic pancreatitis. Something are genetic related. Most of the chronic pancreatitis is genetic related. The entire the pancreatic cells, the acinar cells damage. Beta cells in diabetes, if you look into that, that all the genetically derived. So that's why the diabetic genes, so many genes has been involved, the type 1 diabetes and the type 2 diabetes. So that is not the particular the inflammation. There is its loss due to the mutation the gene. There is a loss of its function. That's why the beta cell, that is the implantation. Suppose same in our institute, so we will do the pancreas transplant, not only the liver transplant. So pancreas transplant for the chronic, this type 1 diabetes with that those who have the CKD, chronic renal failure. We will that time beta cell transmission alone we can do. We can extract the beta cells from the pancreas. Suppose that from cadaver organ, whenever the pancreas, we can isolate the beta cells. Then we can give the beta cells alone into the those who have the diabetic people. But if you look into the efficacy and the long-term outcome, it is not that much comparable with the pancreas transplant. So these are the that time, if whatever your question you are talking about, there is the beta cell related, whether the probiotic alone, whether will control the ongoing diabetes or thing. Diabetes alone, it is not a come under the chronic inflammation. Okay, it is not a chronic inflammation related. Some of the things are, we know the chronic inflammation. Infection will play a one category, non-infection will play a major role. So it is not under chronic.
Yes, sir. Yes, sir. The probiotics, that is the yogurt or the curd have a probiotics. Other than this, any food supplement have a probiotics, so that they will.
So, as far as my knowledge, okay, so apart from this one, whatever the naturally what we are taking, I mean, our food wise, I have not noticed anything there, but I have to ask our nutritionist actually to get the more knowledge about apart from this, any other food item. Mostly, this kind of the fermented foodstuffs will have these kind of the probiotics.
Yes, sir. It is rightly said because there's a lot of question asked about what are the other supplement because he doesn't want to. Maybe he doesn't like the curd. Maybe that's why the doctor is asking from the patient on behalf of patient. Say that pickle and vinegar have a probiotics. Or so it is
It
clear
is
that.
simple answer, better to take a pill. That's all. If they doesn't like the curd,
Yes, sir. That is the best and this one. Yes, sir. Of course, if they don't want to take a curd, definitely a pill is going to help to this. Sir, coming to this probiotics, you have any like duration you have prefer, or it is as per as your and the patient condition on the or it may be a diseases.
see, these all, it is disease modifying some kind of the methodology. It is not like among the multiple, there are several methodologies are there, any to control the chronic inflammation. If you take any disease, so the probiotic is out of the multiple, there is one of the methodology. So we shouldn't go with this only. Okay. So if you are seeing a chronic inflammation, either the disease specific treatment we should continue. That is the proper. These all come under that adding adjuvant to that disease controlling. Okay. See, sometimes we will prescribe for the multivitamin tablet for the diabetic peoples. So we know the diabetic people, high blood sugar, how it affects the sensory nerves, motor nerves. So how the B complex is helping for the myelin sheath formation and but by giving this B complex alone to protect the myelin sheath, it will not help to the patient. We have to control the sugar under optimal range. We have to maintain the euglycemic level. Then by giving this kind of the myelin sheath protection, increasing the, I mean the vitamin B12 related supplement, all will help. Same way, this probiotics, it is not useful for acute. It is all the slow acting, changing the gut microbiota, changing the naturally what happened so far happened, the systemic inflammation reduce the level, and that related the changes.
Yes, sir. It is. It rightly said that it is not a acute. It is for something like chronic. It is not suddenly. It's not going to give a result. So probiotics you can use it depending on the patient condition, the duration. Yes, sir. Any species which you want to in the because there's a lot of already told in probiotics there are many species available. So is it any species which you feel that it is important, or it is all the species available in probiotics is important?
So, but lactobacillus we should keep the primary because most of the probiotics contains the lactobacillus. So that will play a major role. Particularly in a liver disease, we are very particular about to choose the kind of the probiotic with the rich in lactobacillus. But it will vary. Sometimes the pediatric population, sometimes they will give in a different probiotic. They will use the pediatrician.
Yes, sir. Sir, regarding this pediatric, because there is even a COVID also affect the pediatric, and usually pediatric and elderly are more worried about it. So, any role of probiotic you want to mention here, especially for pediatric and more than 65 year with comorbidities?
Elderly people, I would recommend because elderly people, by giving the probiotic, it's always good. Pediatric, suppose if he, I mean the pediatric related the COVID infection nowadays are very less actually, because at that time, I mean, probiotic to the babies, I have no idea. So I have to ask my pediatrician whether they have been their own experience by giving this one. I have no clue.
Ye- Yes, sir. You are said that is elderly people. Yes, the pediatric people definitely pediatrician is the best. So regarding lot of antibiotic prescription, and even the patient himself went, even the doctors are not prescribed, and some patient went to the physician pharmacy and they are taking lot of antibiotics related issues. So this antibiotic definitely going to, as you rightly said, it is going to affect the gut microbiota and also the lung and the liver. So what is the percentage? Because there are, so with this definitely our doctor and the patients also get a benefit. Like you have to be a very much careful, and any antibiotics you have to take. Not about COVID, any other disease. So doctor suggestion is must. So what is your advice on it?
See, the over the counter going and getting the antibiotics and taking for the long term, it is not at all advisable because each antibiotics, if you are going to take a long term, has its own side effect because antibiotics are metabolized in the two organs. One of the major organ is the liver. Take any antibiotic, most of them are will get metabolized in the liver, or some of the antibiotics will get metabolized in the kidney. Even it's metabolized by the liver and it's transporting through the kidney, it is getting excreted. Some of them are the renal and is getting so. Taking the long term without the prescription, if you're taking that's not at all good. There is a long term complication can occur. One of the common complication I can say drug resistance. If you are used to take one antibiotic for long term, normally our body immune system will change. There is develop the resistance to the particular antibiotic. So we don't without knowing that we are keep on continuing the antibiotics. Then whenever the patient gets any infection, it will push us to use the higher antibiotics. It's really unwanted. Okay, so drug resistance is the number one. Second, this gut. It's changed the because sometimes we have seen even not long term, even 2 3 days if we take antibiotic, suddenly they will cause the loose motion. The patient will come with a loose motion diarrhea. Once that time, if we stop, normally what in practice we are doing, we will stop the antibiotic, we will give the probiotics. So many probiotics, we will give the probiotics. Once stopping that antibiotic, after that, by supplementing with a probiotic, it is changing the gut microbiota, so the patients are getting well. That we have seen now. So, if the patient, even though they are not getting the loose motion or anything, if they are going to take the antibiotics for quite long term, as it's going to change the gut microflora, if they have any ongoing chronic inflammation, either liver related or lung related, it will stimulate. Same way, actually, if you take the bone related also, osteoarthritis, so many diseases. Suppose if you look into that chronic inflammation related, the organ dysfunction, not only one organ, bone related, lung, whatever that. Okay, so this and autoimmune related, so many muscular disorder. So any chronic inflammations, I mean, it get aggravated by this kind of the changing the gut microbiota. So better not to take unnecessarily the unwanted antibiotic, and we shouldn't change our normal microflora, gut microflora, in the non-pathogenic into the pathogenic side.
Yes, sir. So over the counter, definitely you are clearly say that is no. You have to discuss with your physician or the doctor for anything. Regarding the same, suppose the patient can go to the over the counter and take a probiotics. Is it advisable, or it is always better to go and discuss with the doctor?
See, sometimes the patients are used to get some knowledge about their based on their previous experience. Suppose they would have been have some upper respiratory or lower respiratory infection or even the GE problem. So they would have first time they would have been consulted the doctor and the doctor would have prescribed some medicine. The second time the same symptom comes, the patient with the previous prescription, they'll go and get the same medication and they'll see the response. Most of the time, the same, whatever the precipitating illness it would be, then they'll recover very well. But if they have the not only the particular infection, they have any other disease, the symptoms, definitely they'll miss the time period. So my suggestion, better everyone have their own the family doctor, better consult, nothing wrong. Okay, so even nowadays they are using that video consultation, online consultation. They can fix the appointment, they can discuss and they can get idea. So the primary doctor who is the knows the patient very well, they can easily identify based on that, because at one time they would have been given the particular antibiotics. At second time, their patient says a different type of symptoms and signs. Even though patient says it's the same, but they know background of the disease, there will be different symptoms and sign, and they will choose the better antibiotics or anything. So my suggestion, better. But suppose fever comes, if they are going to take one paracetamol or dolo 160, 650 something, might say no issues, just for temporary relief. But something beyond that, and at that time also fever doesn't subside for 1 or 2 days, they have to consult the doctor. They shouldn't take it as granted.
Yes, sir. Sir, it's rightly said because it is you used to it. If same symptom comes, take a same prescription, go to the pharmacist and take the medication. Even they don't know what is there inside. So it is always better to discuss with the family physician. So regarding this, coming back to this gut, lung, and the obesity, there is a lot of the question came because since 2 years sedentary lifestyle and sitting continuously in a home, work from home leads to a lot of obesity. So if there is connection between these three, gut, liver, and obesity, and second question they are asking how probiotics will help to maintain this especially obesity problem.
So you correctly pointed out, I mean, the sedentary lifestyle. And nowadays we are seeing obesity even in the younger generation, the school going boys, 13 years old, 15 years old, they are coming with overweight. Okay, and they are, one is their food style. Okay, so they are not taking a healthy, just for taste purpose, they are taking a unhealthy food. And the sedentary lifestyle, there is no games and other things. Most of the time watching the mobile and other thing, overweight. That particular category, when we have done a screening for that liver side, it shows the fatty liver. Just 20 years ago, we are not seen even a younger generation with a fatty liver, but nowadays we are seeing the fatty liver in almost above 40 years, most of them have. And if you take the even younger generation, they have the overweight children. The thing. If you look into that pathophysiology of this overweight, so they are eating good healthy diet, suppose why they are getting overweight and other things. If you look into the pathophysiology, this the overweight related, the high calorie related, everything going for the chronic inflammation, finally end up with the pathophysiology of the leaky gut. It might be the surprise to everyone, but that is the truth. So to stimulate either the hepatocyte, as I mentioned, even the lung, whatever the chronic inflammation, something ongoing chronic inflammation there, some of the triggering factors source should be there. Either source might be there in the same cell or sometime from outside. If you take, for example, hepatitis B virus or hepatitis C virus, the virus cells will sit within the liver, it will cause the chronic inflammation. If you take some of the tuberculosis infection in the lung and other thing means the bacilli related the activation of the inflammation will cause. Same way the COVID related the virus. So one is the direct inflammation due to the pathogen related. Some of the time the non-pathogen, there is no virus, there is no bacteria or fungus, totally non-pathogen. So that pathogen related the changes. For that it comes as the fatty liver, MAFLD, okay, metabolic associated fatty liver disease. There is no source of any infection in their body to stimulate the chronic inflammation. Then how the chronic inflammation? So why I am saying the chronic inflammation? If you take that individuals inflammatory markers assay, interleukin 2, interleukin 6, TNF alpha, if you take the whatever the inflammatory markers, the level will be higher than the normal population. So when organ failure comes, proportionately the blood level, it shows the inflammatory markers level is high. From where the inflammatory markers is coming? So once the inflammatory markers are increasing, some of the triggering factors should be there to induce the antigen representing the presenting cells. This antigen presenting cell has to stimulate the T cell. The T cell will activate the B cell and the T helper and the cytotoxic. That related to Th1 and 2 cell activation, then the inflammatory, the cytokines. So many cytokines are interleukins. We have variety of cytokine, TNF alpha, then the gamma interferon and the NK cells. So if you look into all the patho in molecular level activations, finally the stimulus from the antigen presenting cells. So how the antigen presenting cell is getting activated? Something has to stimulate. From where it is there, antigen presenting cells. If you take a liver, it is within the liver, antigen presenting cells, stellate cells, Kupffer cells. If you take the gut, there is the antigen present within the gut mucosal level. So any inflammation, anything if it stimulates that, if it is that transient means it will not cause chronic inflammation. Ongoing, continuous stimulus, it is causing this triggering. That time only this kind of the all the changes happens. If you take a gut, if there is a normal microflora that is protecting the gut, if we change the normal microflora, if due to the disease related or anything change, it is getting altered, this will cause activating the inflammation. Same way, if you look into that respiratory epithelium, there are a normal microbiota. If you take a respiratory, it has the respiratory epithelium cell and the ciliary cells, so many things are there. If that respiratory epithelial cells, that related, if it gets altered, that time also they will increase the respiratory infection. Once the respiratory infection sets in, whether it's acute or chronic, based on what the treatment option they are going at the same time, whether ongoing chronic inflammation to control, whether we are taking adequate steps or not. So you look into that, these probiotics or the changing everything is the play a vital role, but it is not the only one role. It is the one of the main important factors or the treatment option I can say to modify it.
So rightly summarized, like gu- gut and the lung, which is the barrier between external and internal environment, and it is like a good health for a good gut for a good health. That's what like overall this thing. And of course we have to maintain the symbiotic and this relation with the help of the probiotics. Regarding this, there are a lot of question is asking like, can I take a yogurt whatever available in the market for a year together, whether it is advisable or the curd is advisable?
See, the both are good, but usually the curd is the natural format. So yogurt is slightly modified one. Okay, so my suggestion to them, they can take both, either this one or there is no much difference. Any other, I mean, valid comment, I mean, some expertise might be there, those who are using in the field of nutritionist. So if they have something, the valid comment, I am accepting that comment also.
Yes. Sir, regarding the you told about the gut and the liver axis. So there is a chronic inflammation. You rightly mentioned. How can we come across there is a chronic inflammation in the body? How, there is any test for an intestine, or we have to test the blood, or we have to test the liver function?
Okay. So the chronic inflammation, if you take, suppose liver means there are the specific tests for the to identify chronic inflammation in the liver. There are blood tests. One example I can say, AGPT, AGOT. If you are seeing the patient with the keep on regularly coming to our clinic, always the liver enzymes are very high. We have to understand something is hitting the hepatocytes. That's why the enzymes are getting released from the liver due to the rupture of the hepatocytes. If the patient have always, we are seeing first month, second month, third month, even 6 months, 12 months, we are seeing always the liver enzymes are high. There is a chronic, some ongoing chronic inflammation. That's why the liver enzymes are high. So as a clinician, we have to try to find out the cause for the chronic inflammation, either alcohol related or any viral related or autoimmune related liver problem or any drug induced liver problem. We have to look into that. Same way, if you look into that, chronic inflammation happen in the other organs also. Okay, the chronic lung diseases. So we say the interstitial lung disease. Okay, this is a chronic inflammation. So before to label it as whether the acute inflammation is going to the chronic inflammation or not, we have to look into that. Osteoarthritis, chronic inflammations. So, and the kidney disease. Chronic kidney disease we can say, but if you look into that to end up with a stage 5, first it is for years together it is going, multiple episode of some injury. So we have to look into that. So what is the things, whether the RPGN is converting into the CKD or any other the chronic glomerulonephritis, what could be the reason for either the diabetes related or a drug causing or autoimmune disease, or that all we have to look at ongoing chronic. So if we know the chronic inflammation related source, that time we can try to understand, we can try to control the primary. The gut liver, gut lung related has been already well established. So that is odd iron. Suppose apart from the organ specific injury, this all the increasing. So how to assess, how to know whether there is a blood side, any parameters are there, mean there is the inflammatory markers. But nowadays it is not clean. Nowadays, due to the COVID reason, earlier no one will check the cytokine level, interleukin 1, 2, 6, no one will check. Now, simple thing, they will check the ESR or CRP for the thing. Nowadays, due to the COVID related, so most of the labs are looking into that cytokine markers. If we can look into that not only in COVID, non-COVID also, we can check the cytokine markers. Of course, organ specific will be the earlier. Cytokine markers always will be higher in the above the normal range in any chronic inflammation. So that's way we can come to that ongoing some chronic inflammations there. So rheumatologists, most of the rheumatologists will check the CRP. Nowadays they are started to look into that interleukins also because it's easily available nowadays.
Yes, sir. So rightly said that in the COVID era, a lot of patients come to aware about what is inflammatory markers compared to
True.
the pre-COVID era, and now they actually come to know that it is whatever they say that any spicy food, any outside food. Now they saw that gut has a important function, especially in a chronic inflammation, whether it is a COVID or not in a COVID. So definitely, it's a good intestine health leads to a better health in terms of all the chronic diseases. And you already mentioned about how the probiotics, of course, the primary treatment is something depending on the condition or the disease of the patient. Secondary is definitely try to give symbiotic relation in a gut with the probiotics to manage the diseases. Sir, before there's a lot of questions, but I say that before going into this session, I want what is your key insight or what is the point which, as a physician, we have to know, understand the role of probiotics in the COVID, in this, not a along with non COVID also, and how we manage even after the COVID. Because inflammation or infection will be there lifelong. Today is a COVID, tomorrow maybe another diseases. How to manage, but the body is same lung, liver, and the intestine, which is the major important organ in the body. What is your take?
So if the take a microbiota in the respiratory versus the gut, there are, I mean, the respiratory I already told, there are the normal microflora will be there in the respiratory system. So some of the disease, the normal respiratory microflora will get altered. For example, smoking, that will change the normal respiratory microflora. Their what their job, the dusty, that's so that environment, okay. So, and we know some of them are by environmental factors or the self, our habit, we will change, changing the normal microflora, that will worsen the disease. Same way, gut wise, taking the antibiotics, unnecessary antibiotics, that will change the microflora, the normal microflora. So, one is the prevention, we have to understand, we have to control, and in spite of sometimes it will not be under our control due to the disease wise. Sometimes we will get microflora, so it is not our, intentionally we are not changing. The disease per se will cause some of the respiratory, for example, ciliary epithelial disease. So those who have the respiratory system, who has the ciliary epithelial, that dysfunction, it is not under their control. So they will get the respiratory infection again and again. So how we have to help to them, actually, the clinician. So gut, liver, and gut, lung, that axis we can maintain in a normal way by using the probiotic. That is my conclusion. We can't change the cellular level, the ciliary epithelial damage, or the hepatocyte level, the changes. Some of the stimulus, some of the infections, some of the non-infections will cause the organ-related damage. But for the progression of that damage, we can control by this kind of the gut liver or a gut lung axis or aggravating this kind of the systemic inflammation to control. We have to keep a normal microflora in our GI. For that, the probiotic is helping. So any chronic inflammation, by adding this kind of the probiotics, not in acute infection, acute some antibiotic induced diarrhea, we can use the probiotic, that will help the immediate relief. But ongoing chronic inflammations, it will help. So we should use it, and at the same time, if we have to consult their own consultant also. Once the consultant level, okay, they have to assess, okay, whether the patient requires, how long we have to use. The question will come, how long? Whether we have to use for the entire life? No, it's not like that. So each disease is, once it gets controlled, whether the patient's well, okay, whether we can stop it or not, because these all supplement. So we have to know, okay, so we have to stop and we have to see the response and other things.
Yes, sir. It is a nicely said that probiotics will try to reduce whatever the complication is going to happen. So benefit is definitely there along with this. So it was a very nice discussion, and from the hepatologist point of view, we got a very good insight on the role of probiotics in COVID-19. So I thank you, Dr. J. Varghese, for a wonderful chatting with us about the role of probiotics in COVID-19. Thank you, sir.
Thank you, Dr. Shantos, and thanks to the all the doctors community and all the viewers, and thanks to the ESV, the private partner, and who has taken the effort to for this show. Thank you so much.
Thank you, sir. Thank you.